Dr. Vaibhav Chaudhary is presenting on ocular manifestation in patients of traumatic head injury at Tertiary Eye Care Center.
Good morning, respected members. I am presenting my case on the topic ocular manifestations in patients of traumatic head injury at a tertiary care center. Traumatic head injury is a significant public health concern with a wide spectrum of systemic and ocular complications. The visual system, being intricately connected to central nervous system, is often vulnerable to the effects of trauma. By conducting a comprehensive assessment of these manifestations, we seek to understand the prevalence, impact and outcomes of ocular injuries associated with head trauma. Our aim is to investigate the spectrum of ocular manifestations in patients with traumatic head injury admitted to a tertiary care hospital. Our objectives were to categorize the types of ocular injuries and their correlation with severity of head trauma, to determine the prevalence of ocular manifestations in patients following traumatic head injury, and to assess the impact of ocular manifestations on the visual prognosis of traumatic head injury patients. It was a prospective observational study conducted over a period of 5 months from November 2023 to March 2024, involving study sample of 50 patients with traumatic head injury admitted to SVP Hospital Meerut, a tertiary care hospital. This study was carried on all head injury patients, fatal or non-fatal ones, who were admitted to emergency ward or attended IOPD or referred from neurosurgery to IOPD. Since Glasgow Coma scale is used to grade the severity of head injury and assess their prognosis, so it can be used as an indirect predictor of ocular manifestations and its prognosis. Ophthalmic examination included assessment of best corrected visual acuity, pupillary response, extraorbital injury assessment, extraocular movements, anterior segment evaluation with the slit lamp, visual field assessment, intraocular pressure, diplopia charting, and gonioscopy. The data regarding the demographic profile, mode of head trauma, the type of trauma sustained, and the extent of injuries were recorded. CT scan, MRI, and B scan were also done when indicated. Patients were included, the patients with ocular trauma in association with head injury. And most of the patients who were included were 10 to 50 years of age. Patients who were not included were patients with ocular trauma cases with intraocular surgeries in recent past or who had pre-existing ocular pathologies causing severe visual impairment. So it was seen that in maximum number of patients, the road traffic accident was a major cause in 58% of patients, followed by physical assault in 22% of cases, followed by other causes like fall from height, sports injury, and a case of animal attack, a case of blast injury, and a case of gunshot. So it was seen that in those patients who having a GCS of less than 9, the traumatic optic neuropathy due to orbital wall fracture was a major associated ocular manifestation in 60% of cases, followed by retinal hemorrhages and dislocated or subluxated lens. This was a case of a traumatic dislocation of lens in a lady due to a car accident. Another image shows a superior orbital rim fracture seen on 3D reconstructed CT scan causing an impingement on the optic nerve. Patients having a moderate GCS 9 to 12, the pupillary findings were the most common associated findings. In relative afferent pupillary defect was present in 33% of 0.3% cases, followed by lid trauma and other injuries like field defects, nerve palsy, and retinal hemorrhages and corneal aberrations. So this was a case of a lid trauma due to artery. Another image shows a case of a dilated non-injective pupil due to optic nerve involvement with subconjunctival hemorrhage in a patient due to a physical assault. In patients having a mild GCS, a GCS of more than 12, the periorbital ecchymosis was the most common associated ocular manifestation, followed by lid and brow lacerations. And there was interestingly a case of whole globe avulsion. First image shows a 12-year-old child with intraocular foreign body due to fall from height. Another image shows a 14-year-old child with corneal aberration due to blast accident. Another image shows a 30-year-old male presented with a corneal tear after physical assault. This was a case of a 24-year-old girl presented with whole globe avulsion due to car accident. Surprisingly, the patient was having a normal GCS. When the visual outcomes were observed, was seen at presentation. Maximum number of patients were having a 6x6 to 6x12 best corrected visual acuity. At the 6 month of presentation, 6 month of follow-up, this number increased to 80%. When the complications were observed, the maximum number of patients were having an corneal opacity as an associated complication, followed by uveitis. When the neurological findings were seen, the maximum number of patients were having extracranial hematoma as an associated neurological findings. So from the study, we can conclude that patients having both ocular signs and neurodeficit exhibited a progressively worse outcome as the GCS score worsened. Pupil size reaction are important for initial assessment of head injury, which aids in localizing the site of injuries. The presence of poor visual acuity at presentation, multiple orbital wall fractures, no improvement in vision after administration of steroids. These were the indicators of poor visual prognosis. In the end, it is re-emphasized that the important role Important role of ophthalmic science in diagnosis, progress and prognosis and of neurological patients continues as it was earlier before the advent of CT scan and other diagnostic facilities. Thank you. Thank you.
Okay, so you have included children's also. For any reason you have not included less than 10?
Ma'am, one of the reasons that because children are mostly uncooperative, so we cannot assess the visual acuity or a kind of the GCS also it is hard to interpret from a child.
Thank you.
So you have a valid second date.
No, sorry.
When did you assess the patient?
Uh,
The day of the admission or the very next?
Ma'am, there was most of the patients who presented in emergency, they were observed at the day of presentation. Some cases were referred from neurosurgery OPD after a few days of
Criteria is head injury with the ocular injury or ocular injury with the head injury?
Ma'am, patients who are mainly admitted because of head injury, we assessed what associated sorry ma'am?
Naturally they were admitted patient.
Mostly admitted, mostly were referred from neurosurgery, the kind of reference from other department.
Yes. And one thing you have written MPA chamber hypemia.
Yes ma'am.
So what do you mean by hypemia?
Ma'am, hypemia is a collection of blood.
Yes. So no need of writing MPA chamber.
Yes ma'am.
Dr. Vaibhav, as you have taken the patients with head injury, so most of these might have been medico-legal cases, right? Most of the patients might have been medico-legal cases, right?
Yes ma'am.
So the patients were primarily admitted under neurosurgery or
Then primarily under
did you follow
neurosurgery,
these patients
a case who was presented because of whole globe aversion was admitted under our department. So there was it was not a fixed there was the different kind of study population. Mostly patients were admitted in neurosurgery OPD, and we received a kind of reference from other
how
department.
long have you followed these patients up?
Ma'am, we always counsel the patient. We always counsel the patient for a 6-month follow. Means we counsel the patient, we follow up at different time interval, and mostly 6 months of follow up. Those patients who were reported at 6 months, so those patients are included in my study.
So these patients were like of head injury, okay? So have you found any correlation between the and the types of ocular manifestations you found in these patients?
Means, ma'am, there was no clear-cut correlation. Means, since there was a patient of whole globe aversion, the patient was fully oriented, was have a normal GCS despite having a so grievous injury.
So no much correlation.
Means I just observed what associated manifestations a head injury patient can have in eye.
Okay. And all the patients underwent CT scan had with orbits?
Yes, ma'am. CT scan means mostly a routine investigation in neurosurgery, neurology.
Yes, but usually they go for CT head only.
Yeah,
So
CT.
did you ask them for orbits as well?
Yes, ma'am. CT head and orbit with 2 mm coronal and coronal exit sections.